Hi, guys. For those of you who don't know me, my name is Mike Hansen. I am a physician who is board certified in internal medicine, pulmonary disease, and critical care medicine. Now, as a critical care doctor and as a lung doctor, I want to give my take on President Donald Trump's COVID 19 diagnosis and prognosis, and how I think his doctors at Walter Reed Medical Center will medically manage him. We know that he tested positive in the early morning hours on Friday, so that's today. So basically last night going into today. Today's now October 2nd. He was said to have fatigue, fever, a hoarse voice, and then later on in the day, it came out that he's developed cough, and now just recently in the evening, it's come out that he's had some shortness of breath. And I'm going to get back to that in a moment because that shortness of breath is the biggest red flag in all of that. So while at the White House, initially the plan was he was going to be staying at the White House in isolation and be medically managed there. But then something came up, whether there was a shortness of breath or something else, something prompted his medical doctor at the White House to say, you know what, let's not stay here, let's go to the hospital. While at the White House, he did get zinc, he got vitamin D, he got melatonin, he got Pepcid, aka famotidine, and he also got this new polyclonal antibody treatment, which is a totally new therapy that we don't even know if it works or not, as there are no randomized controlled trials that are even published about this. It's an experimental therapy, and I keep hearing in the media promising, but there's no such thing as promising until you actually have randomized controlled trials that show that promise, or at least some kind of evidence that shows that. And we don't have anything published that suggests that it's promising. So I don't know why some people are saying that in the media. But in terms of what he did get, he got the vitamin D. So with vitamin D, there haven't been any randomized controlled trials for COVID for vitamin D. We know that people with severe vitamin D deficiency do tend to have worse outcomes with COVID. But again, we don't know Donald Trump's vitamin D status anyway, so who knows? There's also some evidence to suggest that melatonin might help, but again, no randomized controlled trial showing this. Same thing goes for famotidine or Pepcid. In the IV form, there's some evidence to suggest that it might help, but again, no randomized controlled trials. In terms of this new polyclonal antibody that he got, this is from Regeneron, the company Regeneron. So it's actually two monoclonal antibodies that come together to bind to the coronavirus antigen. And so in theory, it's going to block viruses or the coronavirus from entering the cells of the body. But theory's theory, and that hasn't been proven yet. So that's what he got at the White House. Then later on, we see him walking to the helicopter, which is significant. In that time, looking at that video, he wasn't in respiratory distress. I can tell because looking at how fast he's breathing, how deep he's breathing, is he using accessory muscles of breathing? So 90% of our breathing is done by the diaphragm. The rest of the 10% is done by what we call the accessory muscles of breathing. So that includes sternocleidomastoids, external intercostals, and such. So based on the fact that he's walking without becoming short of breath, or at least more short of breath, and from what we could tell, he's not hypoxic to the point where he's requiring supplemental oxygen. He's not requiring supplemental oxygen. So that, of course, is reassuring. That at least tells me that this is nothing more than moderate disease. It's probably mild, maybe moderate COVID illness, but nothing more than that, at least at this point. The concern is that this can progress, and it can progress very quickly. It can progress slowly and gradually, or it can progress slowly and gradually and then all of a sudden be a cliff where there's clinical deterioration. Now, according to the press secretary, he'll be hospitalized for several days, but that's of course assuming his disease does not progress. The decision to hospitalize someone with COVID in general, if you're not a president of the United States of America, is based on the breathing. Are they short of breath? Do they have hypoxia, meaning do they have lower oxygen levels? So once it came out that he was short of breath, then it makes sense as to why he was hospitalized, why they made that decision. So initially they said, we're not going to hospitalize, and then they changed their mind later in the day, today. So what is the advantage of being at the hospital? So there's lots of advantages. There's actually some disadvantages too, like you're at higher risk of getting hospital-acquired infections, you're at higher risk of getting blood clots in the body. This is before COVID even. So let's talk about the advantages. Obviously, there's more advantages than disadvantages when it comes to being in the hospital for an illness. So one of those things is you have more access to everything, including different types of doctors. So he'll have access to a internal medicine doctor, a pulmonary critical care doctor, a cardiologist, an infectious disease doctor, a kidney doctor if he needs that. There's also other advantages in terms of frequency of monitoring. So he could have all his vital signs measured more frequently and just has overall closer monitoring of him. You have more access to different treatments, more access to, whether it's breathing treatments, whether that requires supplemental oxygen or a high flow nasal cannula or a BiPAP mask or CPAP mask or even intubation. All these things you have access to and they can be done quickly. So it seems that this is partly at least done out of an abundance of caution, but also there is concern when someone like him has shortness of breath. So when I say someone like him, I mean he's 74 years old, so he's older, he's a male, he's obese based on his BMI calculation of his height and his weight. He may or may not have hypertension. We know that in the past, he's said to have cardiovascular disease, but they just said it was a common form of cardiovascular disease, not a specific medical condition. So whether that's CHF or just atherosclerosis or coronary artery disease, we don't know. But overall, the numbers say that he's likely to come out of this okay. Most people who get coronavirus don't require hospitalization, but he did, at least he is now. There's severely ill COVID, but then there's also critically ill COVID where they require intensive care unit. And lots of times these are the groups of patients that require a mechanical ventilator with a breathing tube, or maybe they're in shock where they require pressor medications such as Levophed, aka norepinephrine. That's something we give in the ICU to stimulate the blood pressure to go higher when it's too low, when people are in shock. And then there's also the ARDS, the acute respiratory distress syndrome. Right now, I can tell you he's not in ARDS because his oxygen levels are too good for that. So he doesn't even meet criteria for that. So when we see COVID-19 patients in the ICU, there's a whole host of things that we're doing, but he's not at that level right now. But if he were to quickly deteriorate with his clinical status, he's right there in the hospital where they can do things quickly and do ICU level of care essentially right away if he were to have clinical deterioration. So getting back to his symptoms, he's had fatigue, someone said lethargy, he's had fever, he's had cough, he's supposedly short of breath, although he didn't look short of breath while walking to the helicopter and walking out. But again, it's very subjective. But he didn't have any signs of respiratory distress. He wasn't breathing fast. He wasn't taking deep breaths, no accessory muscle use with his breathing. He does look very tired in his brief video from the White House, but you can't glean too much from that. So with the feeling tired, with the cough, with the shortness of breath, really it's the shortness of breath that is the most concerning and probably what has prompted them to change his status from being in the White House to hospitalization. So besides symptoms, what else I would want to know as a physician is I want to know his vital signs. What's his respiratory rate? What's his heart rate, his blood pressure? What's his oxygen saturation with a pulse oximeter? I would want to do a physical exam, of course. What do his lungs sound like? Do they sound like there's fluid in those lungs or inflammation in the lungs? So listening for coarse breath sounds, rhonchi, rales, these are all different medical terms. I would do, at the very least, a chest x-ray, but probably, and I suspect they're going to be doing this because he had shortness of breath, I suspect they're going to do a CT scan of lungs, a CAT scan of lungs. But again, it depends on his symptoms, vital signs, and physical exam. I would do blood work that includes things like CBC with differential. I would do a CMP, meaning a comprehensive metabolic panel, and this includes checking albumin levels. I would also check blood clotting labs such as PT, INR, PTT. I would also check a D-dimer. Also other tests as well, like a CK, creatine kinase, a CRP, ferritin, and troponin as well, most likely, along with an EKG. So what are all these things that I just mentioned? We know that when we do a CBC, a complete blood count with a differential, we're looking for something called the white blood cells, and specifically within the white blood cells, a type of white blood cell called lymphocytes. When the lymphocytes are low in COVID-19, these are the patients that tend to have a worse prognosis. And the same can be said for patients with low albumin levels. So that's what we're looking for, or one of the things we're looking for in the CMP, the Comprehensive Metabolic Panel. We're also checking D-dimer levels. So when these are very elevated in COVID-19 patients, they're more likely to have blood clots. I mentioned EKG. I'd probably also do an echocardiogram, again, depending on the symptoms that he's having. This is, based on what I know, COVID can have some cases where there's what we call myocarditis, inflammation of the heart muscle. He's not describing typical symptoms of myocarditis, but then again, these symptoms would be nonspecific, so shortness of breath, chest pain maybe. But because he's the president, they're probably going to do extra testing than they would for most people. So that's why I would expect them to do a echocardiogram. I'd also expect them to do an ultrasound of the legs to look for blood clots in the legs. I would also expect them to do, when they do the CAT scan of the chest, not just a regular CAT scan, but a CAT scan, a CT angiogram. So this is where we inject a dye, a contrast dye, into the vein, and then that gets into the blood vessels of the lungs, and we can see if there's a blockage in those blood vessels. Presumably that blockage is because of clot in the lungs. That's what we're looking for in the CAT scan. So when someone has COVID-19 and they're short of breath to the point where they're requiring hospitalization, that is a big concern, and I wouldn't be surprised if President Trump ends up getting a CTA while in the hospital, but we're still waiting on the medical doctors to give us a report on what's going on. Right now, this is all speculation. So what about treatment? Most patients with mild disease are not hospitalized, but the president is not most patients, and that is why he's hospitalized despite only having mild illness, maybe moderate illness, based on the information that I can glean so far. So let's just say he has moderate illness. So in that case, moderate illness to the point of being in the hospital, then at this point, he would meet the criteria for warranting getting dexamethasone. So dexamethasone is a glucocorticoid, which is a type of steroid. And for COVID-19 patients, we give 6 milligrams daily. That can be either in the pill form or the IV form. I would be shocked if he's not getting Decadron, aka dexamethasone, as we speak. Probably already did. Dexamethasone has been shown to have improved mortality in hospitalized patients with moderate or severe disease. Then there's remdesivir, which might be somewhat helpful in hospitalized patients. But both of these drugs, remdesivir and dexamethasone, they might improve clinical outcomes, but they're certainly by no means a cure. And then when it comes to convalescent plasma, well, he already had received antibodies, so giving him additional antibodies is unlikely to have any benefit. Even if he didn't receive those antibodies, convalescent plasma hasn't been proven to be beneficial in any randomized control trials. And I did actually make an entire video about convalescent plasma for COVID if you want to learn more about that. Then there's the whole issue of anticoagulation, meaning giving him a blood thinner. So blood thinners, they're always given to hospitalized patients even before COVID, unless there's a contraindication, like if they have bleeding or they're at very high risk of having bleeding. But COVID does raise the risk of people developing blood clots, especially those who have cardiovascular risk factors like obesity, like hypertension, like high cholesterol. This is because COVID, the coronavirus, latches on to those ACE2 receptors, not just in the alveoli of the lungs, but also the ACE2 receptors that line our capillaries, the tiniest blood vessels in our body. So the potential for blood clots is a big concern. The other big concern is how extensive is his COVID pneumonia, meaning how much inflammation is there in the lungs. My guess is he's getting a CAT scan of the lungs, like I mentioned earlier, probably a CTA, and on that, they'll be able to see how much inflammation is actually within the lungs. My guess is it probably can't be too bad at this point because he's not requiring supplemental oxygen, but there are known cases where people have lots of inflammation in the lungs and initially their oxygen levels are just fine. And it's not till later on where the oxygen levels start to dip. Another potential treatment, which is typically reserved for critically ill patients, which Trump is not. So critically ill patients sometimes get tocilizumab. This is an IL-6 monoclonal antibody. IL-6 is a central player in the cytokine storm that develops in COVID patients who have severe disease. When patients have very elevated inflammatory markers like D-dimer, like ferritin, and elevated levels of IL-6, these are associated with critical and fatal COVID-19. So I imagine these levels are going to be checked in President Trump. And blocking the inflammatory pathway has been hypothesized to prevent disease progression. Now, several drugs that target this IL-6 pathway have been evaluated in some randomized trials for COVID. These include what I just mentioned, the tocilizumab, but also sirolimus, and then there's a more direct IL-6 inhibitor called cetuximab. So the results from these studies so far have had shoddy results. In one study of over 500 patients with severe COVID, treatment with tocilizumab was associated with a decreased risk of invasive mechanical ventilation or death. Some observational studies have not identified an associated clinical benefit, though, with tocilizumab. And use of the IL-6 pathway inhibitors may be associated with an increased risk of secondary infections, as it makes their immune system more vulnerable to other types of infections. Now, I've given all of these treatments to COVID ICU patients. I've given convalescent plasma, remdesivir, I've given dexamethasone, aka Decadron, and all these things, including tocilizumab as well. And all these things, none of them gave a quick turnaround in the patient's recovery. So do they work or not? Based on my anecdotal experience, it's hard to know because we're giving all these things at once. And the only way to really know for sure is by doing randomized controlled trials. In terms of randomized controlled trials, there's still nothing that really shows much in the improvement of COVID-19 other than dexamethasone and possibly remdesivir, but remdesivir doesn't improve mortality. So the big question right now is his respiratory status. So if he's feeling short of breath, what I want to know is how short of breath does he feel? And then also, what is his pulse oximetry? Is it 95%? Is it 94%? Is it 90%? Is it 85%? This would tell me a lot. Presumably, he's a otherwise healthy guy than what I mentioned before. And so his baseline pulse oximetry is probably 100% or 99%. Some people have lower baseline levels of oxygen because they have certain medical conditions such as COPD, emphysema, pulmonary fibrosis, pulmonary hypertension. These are different medical conditions that cause people to have chronically lower levels of oxygen levels. So lots of times these patients require supplemental oxygen because their baseline oxygen is around 88% or so. But right now, I would say President Trump's respiratory status, seeing him walking, not requiring supplemental oxygen, not in respiratory distress, I would describe his respiratory status as stable. But I am very concerned as to what happens next. Anything could happen in the next hours. It could happen in the next days, sometimes even weeks. I've had patients in the ICU where they require supplemental oxygen for a long time, and then they eventually slowly get better, like weeks to months later. Or I've had to go the other way where they slowly get worse or they all of a sudden quickly clinically deteriorate. It could go any number of ways and we just don't know. But the fact that over the last 24 hours, he's progressing in the wrong direction, that is extremely concerning, especially given his age, that he's a male, that he has this history of high blood pressure, high cholesterol, and with him being obese. So I am going to follow this situation very closely and I will keep you posted. So stay tuned and thanks for watching.